Your kidneys right now, tonight, are quietly doing something most people never think about. While you sleep, your body shifts into a different operating mode. Your blood pressure drops, your urine becomes more concentrated, and your kidneys, those two fist-sized filters sitting just below your rib cage, slow down significantly in how they process fluid. That is completely normal. That is by design. But here is the thing. What you drink in the 2 to 3 hours before you go to bed can either work with that system or work against it in ways that accumulate silently over months and years. And most people have never heard about this. Hi, I'm Dr. James Whitfield. I'm an emergency medicine physician, and I've been working in the ER for just over a decade. In that time, I've personally treated more than 40,000 patients. And I can tell you honestly, the patients I see coming in with kidney problems, urinary tract infections, sleep-disrupted blood pressure issues, even early-stage chronic kidney disease, they almost always have no idea that their habits, specifically their evening habits, have been quietly setting this up for years. My whole mission with this channel is to stop people from ever needing to come through those ER doors. And the best way to do that is to understand what is actually happening inside your body before any symptoms show up. So here's what we are going to cover today. We're going to talk about how your kidneys actually behave at night compared to during the day, because most people assume they just keep doing the same thing around the clock, and they do not. Then I want to explain the real mechanism behind why late-night fluid intake stresses these organs in ways that your morning glass of water simply does not. We'll talk about what late actually means for your body type and your sleep schedule, because this is not a one-size-fits-all number. And then I'm going to give you a simple, practical framework at the end of this video that you can implement tonight. Not tomorrow, not next week. Tonight. Before we get into it, I want to ask you something. Only about a quarter of the people who watch these videos have actually subscribed to the channel. If you're finding this genuinely useful, please consider subscribing. It takes 2 seconds, and it helps this content reach more people who need it. I promise to keep making the most clinically accurate, practical health videos I possibly can. And if you get to the end and didn't learn one thing that changes how you think, feel free to unsubscribe. No hard feelings whatsoever, right? Let's start with something most people have completely wrong. Your kidneys do not work at the same pace all day. This is the foundation of everything we're going to talk about. During the day, when you are upright, active, eating, and drinking, your kidneys are running at something close to full capacity. They are filtering roughly 180 liters of blood every single day, producing about 1.5 liters of urine on average, maintaining fluid balance, regulating your blood pressure, excreting waste products, balancing your electrolytes. It is an extraordinary amount of work that never pauses. But at night, something changes. And this is beautifully simple when you think about it. When you lie down and fall asleep, your body activates what we call circadian rhythm-driven renal modulation. That is just a complicated way of saying your kidneys follow a biological clock. Specifically, your body releases a hormone called antidiuretic hormone, or ADH. You can also call it vasopressin. This hormone tells your kidneys to reabsorb water rather than excrete it. So your urine becomes more concentrated, you produce less of it, and your kidneys essentially slow down their output overnight. At the same time, your blood pressure naturally drops by somewhere between 10 and 20% during healthy sleep. We call that nocturnal blood pressure dipping, and your kidneys, which are exquisitely sensitive to blood pressure because they use pressure gradients to filter your blood, respond to this drop by dialing back their filtration rate. Now here is where it gets really interesting. This system is elegant when it is left alone. You go to sleep, ADH rises, urine production falls, your kidneys get a relative rest, your blood pressure dips, and you wake up in the morning having not had to run to the bathroom every hour. Simple, clean, effective. But what happens when you disrupt it? Let us say you have a large glass of water, or a herbal tea, or a sports drink at 9 or 10 at night, maybe an hour before bed. What becomes clear when you look at the physiology is that you are essentially overriding the ADH signal. Your blood volume increases, your kidneys have to respond, filtration rate goes up, urine production increases right at the point when your body was trying to shut that process down. The result is that you are either waking up at 2 in the morning to use the bathroom, which fragments your sleep and triggers a cortisol spike that itself stresses your kidneys over time, or your kidneys are working hard to process that fluid load while simultaneously trying to operate in that lower pressure, lower output nighttime mode. And those two demands are in direct conflict. There was a study published in the Journal of the American Heart Association that followed over 80,000 adults and found that sleep fragmentation, even mild disruption of 2 or 3 times per night, was independently associated with a measurable increase in blood pressure over time, not dramatically, but consistently. And what we know is that even a 3 to 5 millimeter of mercury sustained rise in blood pressure accelerates kidney wear at the cellular level over years. The endothelium, that is the delicate inner lining of the tiny blood vessels inside your kidneys, thickens slightly in response to chronic pressure. The glomeruli, those are the actual microscopic filter units, maybe 200,000 of them per kidney, begin to show signs of stress. This is not something you feel. There is no alarm, there is no pain. It happens quietly, and it accumulates. Now, I want to be really honest here. This is not meant to scare you. Most people who drink a glass of water before bed are not going to develop kidney failure. That is not the argument. The argument is about cumulative stress over a long period of time, about sleep quality, and about understanding what your body is actually asking for versus what we have been loosely told is just good hydration. Let me explain the mechanism even more precisely, because the villain here is not water. Water is not the problem. Timing is. Your kidneys have a basolateral membrane on their filtration cells, and that membrane has aquaporin channels. Think of aquaporins as tiny water gates, and ADH is the key that tells them to close at night, reducing water loss into urine. When you flood your system with extra fluid before bed, you dilute the concentration of solutes in your blood. Your hypothalamus, which monitors blood solute concentration constantly, detects this dilution and actually suppresses ADH production. So now those water gates are partially open at the exact moment your body wants them closed. Your kidneys are producing more dilute urine than they should be. Your bladder fills. You wake up. Your cortisol rises. Your blood pressure, which was supposed to dip, partially stays elevated. And your kidneys, instead of resting, are running a night shift they were not designed to run. There was a fascinating study published in the American Journal of Kidney Diseases that examined circadian rhythm disruption and kidney function in adults over 50. What they found was that people who consistently experienced nighttime urination, what clinicians call nocturia, more than twice per night, showed accelerated decline in their estimated glomerular filtration rate. Glomerular filtration rate, or eGFR, is essentially the best single measure we have of kidney performance. Even after controlling for age, diabetes, and blood pressure as separate variables, the sleep disruption pattern itself was independently associated with faster kidney aging. So now the question becomes, what time is too late, exactly? And here is where the science is honest about being imprecise, which I appreciate. There is not a single universal cutoff time that works for every single body. What we actually have is a rule of thumb based on several factors. The first is your personal sleep time. The general guidance from the research, including work published in the Clinical Journal of the American Society of Nephrology, is that significant fluid intake in the 2 to 3 hours before your planned sleep time creates enough conflict with the ADH cycle to produce measurable bladder filling and sleep disruption in a substantial proportion of adults. So if you go to bed at 10:30, the window that matters most is probably from 7:30 or 8 onwards. If you go to bed at midnight, shift accordingly. The second factor is how much you are drinking. A few sips to take a supplement or clear your mouth? That is not what we are talking about. A full glass or more of fluid, something in the range of 300 to 500 milliliters. That is where the research shows consistent disruption in the majority of adults over the age of 40. Younger kidneys with better concentrating ability handle this more efficiently. But that efficiency erodes with age, and that erosion is one of the most predictable curves in all of nephrology. The third factor is what you are drinking. This is something most people get completely wrong. People substitute their late water intake with herbal tea, thinking that is neutral, and some herbal teas are, more or less. But others, peppermint and licorice root in particular, have mild diuretic properties of their own. Caffeine, even in decaf coffee, is not completely zero. Alcohol, which is genuinely common as a pre-sleep drink for a lot of people, actively suppresses ADH production directly. So alcohol at night means your water gates stay open, your kidneys keep producing urine, and the night shift never ends. Let me be really honest about something here. What we see in the ER and in clinical medicine generally is that kidney disease follows a predictable arc. Somebody has high blood pressure, maybe unmanaged or poorly managed for a few years. Their sleep is fragmented from various causes, including nocturia from late fluid intake. Their eGFR slowly declines. Their primary care doctor catches it at maybe stage 2 or 3 chronic kidney disease on routine labs. And at that point, the damage is partially irreversible. We can slow the decline. We cannot undo what has already happened to those glomerular filter units. The thing is, there is no emergency for most of that journey. There is no chest pain, no sudden collapse, no obvious alarm. Just quietly, year by year, a declining capacity that you will notice most sharply when you are in your 60s and 70s and want to stay independent and active. And the habits you have tonight are either protecting or eroding the system that will determine that future. Now here is where I want to flip this around and give you the actual framework, because this channel is not about fear, it is about knowing what to do. So the practical framework for protecting your kidneys at night. 5 things, easy to implement, 0 cost, starting tonight. First, set your cutoff. 2.5 hours before your planned sleep time, not a hard 2 hours, 2.5. This gives your kidneys time to process what is already in your system before ADH starts rising strongly. So pick your bedtime and count back from there. That is your last significant fluid window. Second, front-load your water through the day. The most common reason people drink a lot in the evening is that they underhydrated during the day and they feel thirsty at 9 at night trying to make up the deficit. If you hit your fluid intake during the morning and afternoon, the evening desire to drink drops substantially. Aim for the majority of your fluid intake before 4 or 5 in the afternoon. Your urine color by late afternoon should be pale yellow. That is a reasonable guide without obsessing over it. Third, if you are thirsty after your cutoff time, sips only, not a full glass. We are talking about 60 to 100 milliliters, enough to wet your mouth and throat, not enough to meaningfully shift your blood volume and override the ADH signal. Fourth, cut alcohol completely in the 3 hours before bed, not reduce, cut. I know that might be unpopular to say directly, but the evidence on alcohol, ADH suppression, and kidney stress at night is genuinely consistent. If this is a regular habit and you are over 40, your kidneys are paying a price that is not showing up yet in any number you can see. Fifth, if you are regularly waking to urinate more than once per night already, mention it to your primary care doctor and ask specifically for an eGFR test. Do not assume it is just aging, it may be, but it may also be an early, catchable signal that something is worth monitoring. Catching a declining eGFR at stage 2 is a completely different situation from catching it at stage 4. Now, I want to zoom out for a second because this specific habit, the timing of water intake, is a small thing, but it sits inside a much bigger idea that I come back to in almost every video I make. Your body runs on rhythms. Every system, your kidneys, your heart, your immune cells, your gut lining, they all follow a roughly 24-hour clock, and modern life is spectacularly good at disrupting those clocks in ways that